Hello everyone, my name is Autumn Knight, and today we're going to be talking about tobacco use in adolescents in Roxborough, North Carolina. First, a quick windshield survey. So the community of focus is Roxborough, North Carolina, zip code 27573, located within Person County. There's 8,212 people that reside in Roxborough, North Carolina, and the cities that border Roxborough are Durham, Oxford, Raleigh, and Chapel Hill, all within a 30 to 50 mile radius. Housing and zoning of Roxborough consists of residential, commercial, and rural areas, and it normally consists of single-family houses and apartments that are located near nearby lakes, farms, or within neighborhoods. They range from affordable houses all the way to more upscale houses. Zoning is designated to accommodate diverse land uses such as business aspects, residential neighborhoods, and agricultural uses, and this helps maintain a balance between community growth and the preservation of the historic rural charm. Commons and open space. You're viewing a recreational complex called Huck Stansbury in Roxborough, North Carolina here, and this is the only one located within city limits. Unfortunately, it is limited in Roxborough, so if you want to visit others, you have to go outside of city limits, and those would be Allensville Park, Bushy Fork Park, Mayo Lake Park, or Hyco Lake Park. Boundaries include surrounding towns, Oxford, Rougemont, and Timberlake. Residential communities, to name a few, are Highland Place, Scarsdale Village, Willow Hill, and Country Club Heights. Townships are Flat River, Mount Tirzah, Woodsdale, Olive Hill, and Holloway, and larger cities include Durham, Raleigh, Greensboro, and Chapel Hill. Commons and open space. You're viewing a picture of the main boulevard, and you can see here that the sidewalks are limited and there is no public transportation, making commuting to work and other places harder. There's also homelessness present around the city, and as you can see here from this news clip, road conditions are poor and not maintained. This is a sinkhole that's been in Roxborough for a couple years now and still is not fixed. There are several service centers, including Person, Family, Medical, and Dental Center, Freedom House Roxborough, Christian Help Center, Food Pantry, and Safe Haven of Person County. And then stores within the city. You can get groceries from Food Line or Walmart. Pharmacies are Walgreens, CVS, and a local pharmacy called Community, and also one called Kohl's. And then some stores are Dollar General, Family Dollar, Roses, Tractor Supply, and PetSense. Race and ethnicity, there is 46.8% of residents that are white, 33.3% black, 10% two or more races, 7.7% Hispanic, and 2.2% American Indian. And then looking at the health and morbidity of Roxborough, the top 3 leading causes of death are diseases of the heart, cancer, and unintentional injuries. The main religion of Roxborough is Christianity, with the top denominations being Catholic, Baptist, Methodist, and Presbyterian. And some media and politics are the Courier Times newspaper, Channel 11 ABC News, and WKRX 96.7 radio station. Looking at the community as a whole, I made this map that shows access to medical care, schools, pharmacies, convenience stores, and tobacco shops that will be relevant later in the presentation. But in general, looking at strengths and areas of improvement, Roxborough does have a focus on health needs, as you have seen previously from the access to different service centers and also medical care. There's plenty of educational resources such as schools, including a community college. There's a behavioral health crisis support, good air quality, and access to grocery stores. Roxborough needs to improve on the tobacco retailers near or around schools, having to commute to work due to that lack of public transportation and sidewalks. There's a lack of access to specialized care, so you have to travel within 30 to 50 miles to those nearer cities to get specialized health care. There's low educational levels, so most residents within Roxborough have only received a high school diploma, and that's about 84% of people aged 25 and older. And then only 20.7% of people aged 25 and older hold a bachelor's degree, and 16% of the population have no degree. Also, there is financial instability, so about 33.7% of residents live in poverty, and that is double the state's average of 13.2%. The population of focus we're looking at is adolescents, mainly ages 15 to 19 years old. So this makes up about 4.2% of the total population, and listed are the different ethnicities of this age range. North Carolina as a whole consists of 10.6 million people, and there's 49% of those male, 51% female. The median age is 39.1 years old. The median household income is $69,000. Like I said, there's a 13.2% poverty rate, and race and ethnicities as listed. Comparing North Carolina as a whole to Roxborough, the top 3 health conditions of North Carolina are heart disease, cancer, and accidents. And this is compared to Roxborough's cancer, heart disease, and cerebrovascular disease. Access to tobacco. So there's tons of tobacco and cigarette shops around Roxborough, including Discount Tobacco, Madison Smoke and Vape, Roxborough Discount and More, A to Z Vape and Wireless, and 5 Star Vapes and Tobacco. And all of these are located within the vicinity of each other and near schools. There's also tons of convenience stores and gas stations also that you can buy and purchase tobacco products. So looking at tobacco use among adolescents compared to North Carolina as a whole and Roxborough, a significant concern is the high rate of e-cigarette use among high school students in North Carolina. In 2021, there was a 23.8% of high school students use electronic vapor products on at least one day in the past 30 days, and this was higher than the national rate of 18%. And cigarette smoking among North Carolina high school students was 3.9% in 2021, similar to the national rate of 3.8%. And this indicates that while traditional smoking is relatively low, vaping is a major issue. In 2017, the combined tobacco use prevalence among high school and middle school students in North Carolina was 19.7%. The use of any tobacco products among high school students had increased from 25.8% in 2011 to 28.8% in 2017, largely due to the rise in e-cigarette use. And then looking at Roxborough, the 2017 youth tobacco use rate for this area was reported as 25.2% for the use of any tobacco product among high school students, and this was higher than the state average of 28.8%. Also, the North Carolina Institute of Medicine reported in 2019 that the percent of students that had reported using any tobacco product for the area was 25.2%. And then this is just a picture of North Carolina. You can see that there's that 23.8% of high school students using e-cigarettes such as vapes. And then this is just the tobacco product use among middle school and high school students within the 2024 year. So you can see that any product, e-cigarettes, nicotine pouches, cigarettes, cigars, smokeless tobacco, nicotine products, heated tobacco products, hookahs, and pipe tobacco. One thing that has been seen is the most commonly used products are e-cigarettes, which is 5.9% overall increase. 7.8% of these are high school students within that adolescent range. And then also nicotine pouches such as Zens have increased 1.8%, and that's a 2.4% of high school students using those. And then just regular cigarettes are 1.4% increased, which is 1.7% of those adolescents using that. So overall, tobacco products have decreased a little bit within the past 25 years, but a rise in e-cigarettes and nicotine pouches has been seen most commonly within the past couple years. So my community diagnosis was the risk for nicotine addiction related to high prevalence of the tobacco use among adolescents in Roxborough, and this is evidenced by that 23.8% report in high school students of 2021 using e-cigarettes, and then the knowledge deficit of tobacco use, and also the increased availability of access to tobacco products within the area. Some public health interventions include incorporating evidence-based vaping prevention education into health and science curricula across middle and high school grades, develop and implement targeted media campaigns using various channels such as social media to educate adolescents and the broader community about the harms of e-cigarettes, and then support local and state level policies that aim to reduce youth access and the appeal of e-cigarettes, such as flavor bans, restrictions on advertising, and increased taxes on e-cigarette products. Also, conduct workshops and provide resources for parents to educate them about the prevalence and risk of youth vaping and signs to look for and how to talk to their children. Provide access to individual and group counseling services for students who are already vaping and want to quit, and identify underlying triggers that may be causing adolescents to participate in the tobacco use and acquire appropriate resources for medical attention and cessation. So here I have 3 resources that I used that helped confirm the interventions previously stated. So the first was a 8-week non-pharmacological multidisciplinary smoking cessation program for adolescents, and the intervention combined clinical visits, group counseling, and a day camp involving medical professionals, school personnel, parents, and community members. It consisted of 31 students. Later it ended up being 26 in this study due to dropouts from 7 different schools within the area. And it showed that there was a high satisfaction rates among participants. About 28% of the participants showed no codeine in their urine at the end of the program. And it showed that there was a promise in promoting smoking cessation among youth, and highlighted the importance of a multidisciplinary approach and community involvement. And it suggested that future research should focus on larger sample sizes and incorporate lessons from other successful programs. And then the next study was a systematic review aimed to identify individual and environmental factors that predict vaping cessation-related behaviors, such as intention to quit, quit attempts, and vaping abstinence, in people aged anywhere from 10 to 35 years old. And they searched 5 databases and gray literature, ultimately including 24 studies that met their criteria. And it synthesized 106 predictors. And the key findings of this study was the intention to quit vaping. Probable factors increasing the likelihood included disposable e-cigarette use, using e-cigarettes due to peer family vaping, high harm perceptions of vaping, and exposure to anti-vaping content. The quit attempts probable factors were using e-cigarettes out of curiosity and high harm perception of vaping. Vaping abstinence probable factors was facilitating abstinence because of the high harm perception of vaping. And then the next article was a systematic rapid review aim to identify effective policies and non-policy interventions for preventing vaping initiation among youth aged 6 to 18 years old who had never vaped or had experimented with vaping. And this also assessed the effectiveness of interventions based on their level of intrusiveness and impact on different subpopulations. The results showed that 20 studies were included. 45% were experiments or quasi-experiments. 85% reported data from the USA. 65% were non-policy interventions. 40% measured susceptibility and attitudes related to vaping. 35% measured behaviors related to vaping. And then regarding intrusiveness, 45% of studies provided information and 25% eliminated choices. So overall certainty of the effectiveness of the interventions varied by the outcome and level of intrusiveness. And some interventions positively affected multiple outcomes. So combining multiple interventions targeting different levels of intrusiveness and outcomes may be more effective in preventing youth vaping. So tailoring programs to younger youth is also important. And then these are the resources in combination with the previous 3 that I use to gather information on the area. And thank you for your time and attention. If you have any questions, please let me know.